Everybody. For many back surgery patients, the use of narcotics becomes a long-term problem. So perhaps it's time to take a second look at your treatment options. Dr. Eric Roget is back, a Cleveland Clinic-trained neurosurgeon who's had many successes with patients that have not had success with previous surgeries. It's great to have you back.
Thank you.
You do provide a tremendous opportunity for people to get their life back because you can take care of their back pain and their neck pain. And people think that they've had to live with this for so many years.
Well, some have actually.
Mm-hmm.
One of the things I wanted to talk about this morning is there are many people that have had multiple back surgeries, cervical, lumbar, neck, back, combination of both. Some of them have had 12, 13 surgeries.
Oh my goodness.
And are still suffering. And some of these people have had surgeries many years ago. And back then, they were investigated for other things and eventually just ended up on narcotics. And for years and years, they just continue with the narcotics. And there is a place for narcotics, but the problem is that your body gets used to the narcotics. And so you get a benefit from them, then your body adapts to it and your pain comes back. So then you up it a little bit. And even if you up your dose every year or every 2 years, after 10 years, you end up on a very high level of narcotics, and it's still not helping you or not helping the amount that you need. And so it's become a big dilemma, Western New York, but really all over North America. And I think it's important for people to know that it may be time to get a fresh look. It may be time to look at an MRI of the neck, look at a CT scan to see, well, is the fusion actually solid? The fusion that was done with the screws, the rods, and the bone several years ago, did it actually take? Maybe it did not take. Maybe the screws are loose. Maybe the person is wearing down either above it or below it. And then there are some patients where everything looks fine. We see them, we get an MRI, it looks fine. The CT scan, everything is the way it's supposed to be, nothing is wrong. There still is another option for those people as well. A spinal cord stimulator, we had talked about that in the past, can work wonders for these people. I actually saw 2 patients this morning that have had multiple surgeries, and they were really at their wits' end. One patient, it's the first time I met him this morning. The other patient, actually, we did surgery on her, and she's doing exceptionally well. So it's nice to see that we can help these people that have been suffering for such a long time.
And it sounds to me like the person you're talking about may have been told by their present doctor, there's nothing more we can do for you. You're going to have to live with it. And that's the person who needs to call you. Do they need a referral from that doctor to see you, or can they just call you?
They can just call us.
Okay.
Often, certain insurance companies will require that they get a referral, and we'll simply ask them to get a referral from their family doctor. Many of the patients that we see who have had multiple surgeries and are coming for a second opinion actually see us on the show. And they thought that there was really nothing more that could be done because, as you said, they've been to the Cleveland Clinic, they've been to Rochester, they've been to different people in Buffalo, and people have put their hands up and said, "There's
nothing else we can do.
There's nothing else we can do for you." And it may be true, but if that was an opinion several years ago, things may have changed.
Yes.
The technology may have changed. There may be new options for these people.
And often, those options are not nearly as invasive as what this patient may have already been through. So you may be thinking, I can't go through this again. Well, you may not have to go through that again. Today's options are totally different than what they were when you were probably originally treated.
Right. And it's challenging in Buffalo because, let's face it, the majority of surgeons really would prefer not to deal with that kind of situation. And so most surgeons in Buffalo typically don't see other people's surgeries. So these patients, they're kind of isolated. They really have nowhere to go. When I was at the Cleveland Clinic doing my fellowship, the majority of the patients that we were taking care of had previous surgery.
And this is exactly the patient who you will see.
Exactly.
We want everybody to know that. Please don't live with that pain anymore until you have Dr. Eric Roget take a good look at you and let you know what today's options are. And he's right here at 700 Michigan Avenue. Easy to find if you're coming down from Canada or right here in Buffalo. Please give that office a call right now and make that appointment. You've got nothing to lose but your pain. 853-BACK, 853-2225. Or log on to eric, ROGER.com.